Good afternoon. My name is Dr. Shondell Knights. I am a naturopathic physician practicing in Maryland and DC. I have over 10 years of experience practicing medicine, and I've practiced everywhere from California and then DC and Maryland, as I mentioned. I especially specialize in IV therapy infusions, and those infusions can vary from oncology infusions or integrative medicine infusions for cancer patients. I also have IVs for autoimmune disease, detoxification, fibromyalgia, energy, and much more. I am currently a pending fellow as a naturopathic oncology fellowship. All right, so this presentation is intended to give information and is not a substitute for diagnosis or treatment. Please see your oncologist or primary care physician for a treatment plan. You can also visit our clinic as we are an integrative medicine specialty. I also need to do some house cleaning here. FDA requires us to say that cancer can only be treated using chemo, radiation, surgery, or immunotherapy. However, our experience in the clinic with helping our patients, both who are undergoing conventional treatment and those who opt to not do conventional treatment, has only been improved by using IVs and oral protocols such as the ones that I'm getting ready to speak about. So without further ado, let's get going. All right, so the first thing we're going to kind of give an overview. So some of the infusion therapies that we offer in our office include high dose vitamin C, IV mistletoe, IV ozone, glutathione. We also offer metabolic therapies such as poly-MVA and acetocure. We're going to start off by talking about the metabolic therapies. And in order to do that, we must first understand how this works. So poly-MVA is part of a metabolic treatment plan. And what that means is we are aware in the medical community as well as in the research community that cancer cells grow faster than other cells. And one of the ways it can do that is that it can really utilize things like sugar and an oxygen poor environment, such as those environments found where there's a lot of inflammation, to grow faster than surrounding cells. And that's the damage that cancer cells can do to your body. So everyone has cancer and cells in their body, but not everyone develops the disease. And there has to be a combination of things that lead us to developing the disease known as cancer, where our normal cells have now overgrown to the point that it's crowding out our regular cells, that it's taking our nutrients, that it's causing structural damage, like, for example, blocking arteries or impinging upon the function of other organs. So when we're doing metabolic treatments or therapies, our goal is to starve the cancer and feed healthy cells. And that's able to be done because we know that certain things like sugar can really greatly impact the growth of cancer cells, whereas not our cells doesn't always need sugar to function. So when we talk about metabolic therapies, we're going to utilize minerals and vitamins and nutrients to allow our body, our healthy cells, to grow while starving our cancer cells. And so poly-MVA is one of these unique minerals. And by the way, I have no affiliations with this company or no financial incentives. I just simply like the product and I find it to be effective in clinical practice. All right, so poly-MVA is able to transfer energy or create energy source in the mitochondria, the powerhouse of the cells. And we're going to see a picture of the powerhouse shortly. In order to give more energy to healthy functioning cells. So it is a mineral, vitamin, and amino acid compound that's primarily made of alpha lipoic acid, which in the studies has great clinical studies in terms of decreasing tumor size. Thiamine and palladium which are both fat soluble and water soluble. So it allows for the absorption of this this compound. It's also in a liquid form, so it's highly absorbable. Okay, so poly-MVA works by enhancing energy production in healthy cells through boosting oxygen pathways while disrupting dysfunctional metabolism that is found in cancer cells that prefer a deoxygenated, and that's important when we talk about combining therapies. We have a deoxygenated pathway that cancer likes and a sugar-rich pathway. And so, by the way, none of these therapies that I'm going to mention should be used alone. They need to be used in combination. So while poly-MVA can help increase energy production in healthy cells, you still need to think about, well, how do we decrease the growth in the unhealthy cells? How do we increase oxygen? Because it helps you absorb oxygen, poly-MVA does, but you need to actually add oxygen into the body as well. So hence IV therapies such as ozone and hyperbaric oxygen chambers that help you to bring oxygen into your tissues. And we'll get into those IVs as we go along. Okay. So here are some of the studies that show the benefits of poly-MVA in upregulating increasing mitochondrial function and also supporting gene repair. So LAMC is the medical name that we use in studies because most of these studies, especially the ones done by NIH, which this was done and published in PubMed, they prefer to use a non-company affiliated term. So LAMC is effective in protecting cells and then safely provide energy to them. Many years of research and clinical studies provide consistent and ongoing evidence poly-MVA can support gene repair in genes that have been damaged by radiation. So this is a good after and before treatment for in face of radiation, and it can be used with chemotherapy. And it allows you to support multiple therapies and cellular degeneration because the mitochondrial upregulation with increasing oxygen. So we want to increase oxygen into the tissue, and poly-MVA is one of the minerals, or I guess I wouldn't call it a mineral itself because it is a mineral, vitamin, and amino acid, one of the complexes that is quite unique in helping that upregulation. So you can feel free to look up any of these studies by clicking the link, and it will talk about some of these, talk about the studies. Okay, so another study here showed that, all right, the study results showed an overall response rate from both groups of 56%, which included the following response: stable disease, so it was able to stabilize disease, partial response, and complete response. So partial response would include a decrease in size, so 50% reduction in size. Complete response would be disappearance of the tumors based on physical exam, screening, and tumor markers, or a just stabilization of the disease, a decrease from progression. And when we talk about stage 3 and stage 4, especially stage 4 cancers, where or terminal cancers, as the conventional world will name it, often those patients are told, well, there's nothing we can do, or let's try a palliative treatment plan with radiation or chemo, which is ultimately has in the studies, palliative care with chemo is not effective and does not increase lifespan. And I can't remember the studies at this moment, but that's those statistics are out there. And so if in terms of using a therapy like this, if we can stabilize the disease and decrease progression, I put that in a response rate column because sometimes we're not able to reverse stage 4 because it's gone so far into the tissues and caused so much destruction. But what we may be able to do is stabilize. Now, I do want to say something. Seeing a lot of cancer patients, it is not one of the easiest fields because oftentimes patients come to me when they've been told to go home and there's nothing to do. And it's incredibly hard to stabilize such a condition because of all the responses that have gone on in the body. And in general, the success rate for cancer is not phenomenal. We have not found a cure, and by no means are any of this a cure. Some patients will respond, some patients will not respond. But in this particular study, 56% of patients did respond in one way or another. The overall response rate in patients who received both chemotherapy and poly-MVA was a little bit higher at 61%. And so, although I am not a personal believer in chemotherapy, I do see that we can use poly-MVA and some of these other therapies to help the body heal and have better outcome rates than either chemotherapy or poly-MVA by itself. In my practice, I do not use chemotherapy. I use other therapies that are able to stop the growth of cells. But if you're going to go the conventional route, please consider adding in a therapy like poly-MVA. And remember, none of these therapies should be standalone. And it is my belief, even chemotherapy, if we do elect to do chemotherapy, it should not stand alone. We should address nutrition. We should bring in supplements that help to mitigate the damage that the poison that chemotherapy will do to your body. And in the studies, like I said, 61% of patients responded. There was a better success rate. But I would never do poly-MV alone. I would never do a group of people with only on poly-MV. I would always add in different therapies because it upregulates, like I said, energy to the mitochondria. It helps improve oxygen metabolism, but it does not, it has a lot of other areas that cancer needs help in. When we get to the final slide, you'll see how I combine all of these different therapies. But yeah, let's get back to the study. So 61% who did chemo and poly-MVA had a response rate. The overall response rate in patients who received poly-MVA supplement alone was only 39%. Again, never do it alone. Patients receiving an initial IV dose, and let me say something, IV was very common maybe 2 years ago, and it's been harder to get IV poly-MVA, but the oral protocol works well too. It may be not as effective, but it is quite effective. And the benefit of doing the oral is that you don't have to come into the clinic. You can be anywhere in the country and do the poly-MVA. All right. You can purchase it directly from the company. If you do purchase it through our company, if you're on a program, you do save because we get a discount that we pass on to you guys. All right. So poly-MVA, initial loading dose of poly have a 12% improved response than oral alone. So you have 12% better improved response than doing an IV in doing an IV versus oral. But if you are not able to get the IV, which many of our doctors are not able to right now, you still have a pretty good success rate. And keep in mind what we're meaning by that, that 56% of patients who did a combination therapy had either partial reduction in tumor size, a complete reduction, or stabilization of their cancer. And most of the times, like I mentioned, we were talking about stabilization, we're talking about stage 4, who would otherwise be rapidly progress to end stage cancer. All right. Some other studies, I'm sorry. So the anti-tumor effects of the palladium plus alpha lipoic acid, which is what poly-MVA is, has multiple studies. And feel free to go through these studies. These studies show that patients that took poly-MVA once a day for 2 weeks had anti-tumor effects and normal cell proliferative activity when used in the face of radiation. Another therapy that I personally don't do any offers or don't offer, and I'm often very hesitant to recommend it, but sometimes a patient will come in who's so advanced that we need to slow things down. If we see that radiation, or you're working with an oncologist that is doing radiation, poly-MVA is one of these minerals that is a must in terms of increasing the anti-tumor effects of the radiation, but also helping the tissues to heal. So this is a good summary of multiple studies. If you want to click into it, it's probably the easiest to read. All right, so then let's bring in AcedoCare. AcedoCare has over 102 ingredients, minerals, vitamins, herbs. And what this does, it creates a cellular pathway similar to poly-MVA, but on a different level, where it allows for enzymes that block the compounds of ATP in cancer cells. So now, on one hand, with the poly-MVA, we're helping normal, healthy cells to grow and proliferate. And then with the AcedoCare, we're helping to block certain areas or pathways that cancer cells will take. So this 1-2 punch means that we're starving or decreasing the food source, the available food source of cancer cells, while promoting the food sources that are healthy for our healthy cells. And when we talk about this, like, nutrition is ultimately important. Whenever you're doing AcedoCare and poly-MVA or any treatment, you have to be conscious that you're not bringing in a whole lot of manufactured sugars. It is okay to do small amounts of berries that have anti-cancer effects as well, but eating a ton of sugar really goes in the face of these two treatments. So it is important that we combine these two therapies with a solid nutrition plan. And we will have another class coming up, and these classes are free, that will speak about the type of nutrition that you want to have while you're going through treatment. All right. So it also showed that it improved this Acetocare was able to improve energy and healing and immune system. And so there are studies on this as well. Oh goodness, I will have to send you guys the study. I think I put it in a different, but I'll send the link. Um, and for these. All right, so this is the mitochondria, the powerhouse of the cell. Oh, this one is the Acetocare. I'm sorry, this is one of the studies. ATP inhibitors. So the way that Acetocare works by blocking the way that cells metabolize or proliferate. Novel approach in arresting cancer cell proliferation. So let's see here. Where do we go? In several studies, acetogens, which is Acetocare, acts as an ATP inhibitors that blocks this enzyme, thus blocking ATP production within the cancer cells. What was also discovered is that the normal cells produce energy via several pathways and not just one. So ATP inhibition does not affect the healthy cells. So our cells do have other options of producing energy. Cancer cells tends to like this one because it's the easiest pathway to go to produce energy. So when we're blocking ATP synthase or synthesis, making of ATP, we can block the cancer cells um, and effectively starve cancers. But again, you never use one protocol at a time. All right, let's keep going. So let's get into the IV therapies that we offer in our clinic. High dose vitamin C is one of the ones that has been well studied and was originally discovered or utilized uh, by a gentleman here, Linus Pauling in Baltimore, Maryland. He noticed that a lot of patients that were vitamin C deficient had similar symptoms to those of cancer cells, and he began administering high doses of vitamin C in his office, and he had quite a great effectiveness. There have been a lot of studies there was a study after that with a gentleman who only did oral IV, and he did not oral vitamin C and did not see all of those results. And so for a long time, Linus Pauling's work was was not used. But recently, there have been a ton more studies that have shown the effectiveness of vitamin C. And this is one of the only ones that actually appear on the FDA website as being effective in decreasing tumor cells. All right. So one of the things vitamin C can do is produce hydrogen peroxide that can. I'm sorry. A study in the Holden Comprehensive Cancer Center at the University of Iowa shows that IV vitamin C can produce hydrogen peroxide that can damage tissue and DNA. The study also showed that tumor cells are much less capable of removing damaged hydrogen peroxide cells than normal cells. So even though it damages healthy cells, those our healthy cells are able to repair faster than the cancer cells. Therefore, cancer cells are much more prone to damage and death from high amounts of hydrogen peroxide produced by the vitamin C. So this is different than the way chemotherapy works. When I think about chemotherapy, it's like it is adding a poison into the body and hoping that the cells that are growing the fastest will die before the host, the human, the person dies. And that's why we get so much damage to the cells that are faster. That, for example, you hear follicles and the intestinal lining, all those cells are turning over rather quickly. And so those get damaged along with the tumor cells. And, patients that die as a result of chemotherapy, they die because their tissues aren't able to repair. Hydrogen peroxide does not damage to that level, but can slow down and stabilize and even reverse the tumors because they kill them off. And then our cells can repair much faster. And this is at high doses. It is important. And actually, this first slide, even though it's a little foggy, it shows what we mean. So vitamin C sometimes patients will say, well, why can't I just take oral vitamin C? You can, but you'll never get to the dosage that's effective against cancer cells. So we go between 50 to 100 grams. The average person can do about 20 grams maybe before they have pretty wicked diarrhea, because your body won't be able to tolerate that amount of vitamin C. But when we do it intravenously in your veins, we're able to raise the plasma level or the level in your blood to a dose that is able to produce enough hydrogen peroxide to cause the destruction of cancer cells. Okay. Um, so, and the side effects, the long-term side effects, was found in less than 1% of patients. And those side effects were very minimal. So, minor irritation, some tiredness, some change in mental, and this one I think is the most common, vein irritation. So, often in our practice, when we are doing high doses of vitamin C over a period of time, because you do need to at least do 2 sessions per week, and sometimes 3, and it lasts about 1 to 3 hours, it takes time. And so we'll often write a prescription for you to get a PICC line put in that way. And a PICC line is simply access to your veins so we don't have to keep sticking. It's a safe way to get, and that PICC line can last for a couple of months. And it's pretty safe and very low side effects from them for putting in a PICC line. All right, so high doses of vitamin C. So here comes some of the studies. There are a ton of studies going on right now as more and more, as this becomes more and more available. In fact, I noticed that there were several pharmaceutical agencies that started to produce high dose vitamin C, and their prices are outrageous for the same vitamin C. But again, when it comes to, oh, let me not jump into that. I was going to talk about the costs, and how we often see some of these cancer treatments being so outrageously priced, that sometimes it prices people out of getting it. And vitamin C is one of those that is in danger of getting so highly priced because the pharmaceutical industries are seeing the effects and in cancer and wanting to get in on that. But for right now, we can get them made at pharmacies at a decent price so that people can afford it. All right, so 75 to 100 grams has exhibited through multiple studies over 50 years to be effective at decreasing tumor size, stabilizing stage 3 and stage 4 cancers, improving quality of life. This is the other thing. Stabilization and improving quality of life is really important. When we think about the stage 4 cancer patients, we often get this picture of this really thin, emaciated, pale, hairless person. And that's not what we find when we're using vitamin C and natural treatments. Even though, like, sometimes we're not able to stabilize the cancer, and patients do die in any part of oncology. But the improving of the quality of life before that patient's die, it's such a difference. When I see a patient who's taking vitamin C, they still have energy, they still can communicate, they're still having a quality of life, they're not stuck to a bag of poison as in chemotherapy. And it is and we're thinking about this in terms of stage 4 cancers, but we can see stabilizations of these cancers with vitamin C as well. And decreased tumor in stage 1 and 2 is quite effective. High dose vitamin C can make chemotherapy drugs stronger. So if you are doing chemotherapy, I would have to have a conversation with your oncologist and make sure that they are aware of this so that they can do lower doses of chemo. So that's another effect. With the right oncologist, we are able to work with them and they can lower the dose so there's not as much damage if you are doing chemo. Vitamin C makes a nice addition to a metabolic protocol. We have the starving of the cancer, and then we have destruction using hydrogen peroxide that is produced vitamin C. So here are a couple of studies to go through, and there are a lot of them. There are probably about 50 studies that are going on currently with vitamin C. In a majority of cancer types, most in vivo studies, so that means in actual human studies, have shown the inhibition of tumor growth between 40 and 60% by using high doses of vitamin C. And so these are some of the other trials that are going on right now. Okay. So vitamin C also helps with metabolism of trypsin, folic acids, and tryptophan, helps you with clarity, mental clarity, and energy, helps the body to absorb and break down histamine, which is, the allergy. So for people with a lot of allergies, these are some of the effects outside of cancer that vitamin C has been shown effective at doing. This big one, though, protects DNA damage due to free radicals and mutagens, reduces the risk of premature death. So vitamin C has have a ton of studies. Please go through them. All right, let's get to mistletoe. Mistletoe has been in studies even longer than vitamin C. It probably has over 150 years of studies. And this is widely used in Europe and Asia. It's one of the first line therapies in those areas because of its ability to create cell death or apoptosis. It also is able to stabilize cancers and prevent normal cells from helps prevent damage uh, of normal cells while going through chemo and radiation. Now, I said before that vitamin C is one of those that can make chemo stronger. So it's often that I won't use vitamin C unless I'm working with an oncologist who's aware of the effects of vitamin C. But mistletoe can be used safely with chemotherapy. And it also helps, like the poly-MVA, to decrease the damage that's caused by chemo and radiation. Um, it also boosts cytokine activity and natural killer cells. And just a side note, before any of these therapies are able to be started, we must have blood work in the office to make sure that all of this is safe for you, and then also to measure treatment. Because in order for me to measure effectiveness, one of the ways I can look is to see if it is, we take a baseline of your natural killer cells, and then we take test about 2 weeks after we begin administration of mistletoe to see how your body is doing. Okay. So mistletoe is a semi-parasitic plant, and if you see this picture here, it's growing. It's kind of taking over this plant. And that's what it means by semi-parasitic plant. And there are several types. And yes, we do kiss under the mistletoe. It's not the same one we use. The ones we use are the European variety. The ones you often see in the holidays are the American variety. Mistletoe extracts are widely still studied as a complementary and alternative medicine therapy. And I'll have some questions to refer to these. It can be given as an IV, or one of the reasons I like mistletoe, it can be given as an injection under the skin. Now, it is more effective in veins, but you still have an absorption rate that's high when we do it as a subcutaneous injection. And the reason that's important, if you're not able to get into the office very often, then you can do this injection at home. All right. And it's done with a small needle, and most patients can do it and tolerate it very well. Some of the side effects that we have seen is redness at the site of injection. And that's important because the redness are cytokines. So that tells me that it's actually working. And those redness might last a day or two and then dissipate. But what's happening in the inside of the body is that it's creating these cytokines of these healing cells that go about one healing tissue and can also help in the destruction of tumors. Very few side effects outside of that. Similar to the profile of vitamin C, very, very few side effects. So please go on cancer.com. You'll see a couple of this whole slide was taken from cancer.com. All right. So in breast cancer, a study in post-operative early stage breast cancer, so stage 1 and 2 cancers, compared standard treatment alone and mistletoe extract to standard treatment alone. Less adverse effects were reported in the group given the mistletoe. So patients had less downtime after that surgery and less recurrence. Another study in breast cancer patients compared survival rates for those who had standard therapy alone, so conventional chemoradiation surgery and mistletoe extract, and those who had standard therapy alone. Improved survival rate was reported in the group giving mistletoe extract. In colorectal cancer, this one has a lot of studies found that patients treated with mistletoe extract had longer disease-free survival. So in the conventional world, survival rate on average for most cancer patients is 5 years. After 5 years, they consider, if you make it to 5 years, it is considered a success. But what happens after 5 years? We often lose patients right after the time. And so this study showed patients that went the conventional way and did mistletoe had a longer survival period with fewer side effects and better symptom relief than doing the conventional therapies alone. Pancreatic cancer showed that in 2013, a study in PubMed that mistletoe extract in advanced metastatic pancreatic cancer, which is a very deadly cancer. Patients received best supportive care and were randomly assigned to receive either mistletoe extract or no anti-cancer therapy. Results from the study showed that patients treated with mistletoe extract had improved survival compared with those who did not receive mistletoe. All right, so this again, as I started this study, the only thing that are approved for chemo radiation by the FDA, I'm sorry, only thing approved by for cancer treatment by FDA is chemo radiation, immunotherapy, um, and surgery. So none of this has been approved, and it is used as an off-label because there are so many other effects um, for mistletoe and vitamin C, so many other positive effects that you can use it as an off-label. But again, I find it very effective in my cancer patients. Now we're going to get to glutathione or GSH. This one I only use before a treatment because there have been a lot of great studies. So glutathione is your body's major antioxidant. It's your biggest cancer fighter that's naturally in your body. But cancer, being with us for a while, has been able to sometimes co-opt or take this pathway and turn it in for its use. So while we're undergoing treatment, um, it can provide a blocker. And these studies are still pending a few more outcomes. But the studies have initially showed that it can protect your healthy cells, but it can also protect your unhealthy or cancer cells in some patients. So I don't, from the chemo. So I don't use this if we're doing chemo and radiation during that treatment. I'll use it before and after to help heal your cells, but I would never use this during actual chemo or radiation. But a combination of glutathione, poly-MVA, acetocure, vitamin C, mistletoe has been rather effective with my patients. And then you add in ozone therapy. Ozone therapy is the where we add oxygen into the body clinically. You can use a hyperbaric oxygen chamber here as well. I do not possess a hyperbaric oxygen chamber, so I don't have it on my slide, but it's another way to get compressed oxygen into the tissues. Ozone therapy is also very effective at doing that. Ozone therapy, O2 is the oxygen that we breathe. Ozone therapy is O3. So it's a way to get oxygen into your body because when we put ozone in, it turns into oxygen. And it's able to help support that metabolic process. Whereas we are putting so much oxygen into the environment, it can suffocate cancer cells. So it increases oxygen concentration in healthy cells, decreases inflammation, improves immunity, and boosts a poly-MVA protocol. So this is a study that showed that. All right. So um, the way we do our protocol. So if we're doing before chemo, if we're doing chemo and radiation, it's a little bit different than that way I would do it if we're not. So for someone who's going through chemo and radiation, we start 1 week before treatment and we'll do the glutathione. We'll start you an oral poly-MVA, high dose vitamin C at 50 grams, and then mistletoe injections. 3 days before, we also do the poly-MVA IV. I'm sorry, IV or oral, depending on what's available. The oral poly-MVA, 75 grams of high dose vitamin C, mistletoe injections at 10 grams. And then 1 day before, we're increasing the dosage as we go along. Post-treatment, we're at our highest dosages here on all of our therapies. And then we continue this treatment for 7 to 21 days before retesting and see how the body is doing. Patients that do this protocol, as again, have much less side effects. Their body is able to heal better. But you want to keep some protocol going for a few years because and mistletoe is usually the one that I go to because it's easy to do at home. You would also come in maybe every 3-4 months, depending on your condition or the stage of your cancer, and do vitamin C. But keeping your body as detox is important here because remember, chemo is a poison. And so is radiation. And well, radiation damages the cells in another way, but ultimately, in both ways, cells are damaged. So you have to be aware of that and constantly be on a repair mechanism if you're going the conventional route. But these therapies are effective in helping you mitigate some of those effects and help your cells to heal after. For someone who is not going through chemo and or radiation, we typically start with a higher dose once the blood work, and we do titrate you up. So we need to start at a lower dose and work you up. But as long as your body is able to handle it, so we do the blood testing and all of that ahead of time. And some reasons for not being able to do vitamin C would be having a G6PD deficiency, which is an something you would have been born with, but high doses of vitamin C with a patient that is G6PD deficient can often lead to breaking apart of the red blood cells. So we're very conscious about doing labs and making sure that the best treatment is used for you. Some people can do vitamin C, some people cannot. Most people, I haven't seen anyone who cannot tolerate mistletoe. But again, we always, and even IVs, if your kidney function is severely decreased, then an IV might not be the best option, and mistletoe might be your only option there. So it depends on the person, but the labs and the consultation will determine which way we go. And we're always doing follow-up consultations. So typically we go through 3 times a week, as I mentioned, of mistletoe injection, and twice a week of vitamin C, high dose vitamin C. And then we're also either adding in ozone or an HMOP therapy, and we're doing a metabolic therapy. We also include water fasting because that's also shown to improve your natural killer cells. And natural killer cells are really helpful in in supporting cancer growth. So we repeat tests and we repeat scans quite often. All right, so then we need to put all of those missing pieces together. And really the best way to have the most effect in cancer treatment is to combine all those therapies. Okay, I hope I've helped you understand what we have going on. Please give us a call if you have any additional questions or if you'd like to schedule a consultation.